In the videos that you're about to see, you'll see some people describing how and why they decided to join psychological professions.
I decided to become a counselling psychologist because I had a background in counselling and mental health and I wanted to build on that experience. I chose the counselling psychology doctorate because I wanted that experience of developing my practical clinical skills and also academia. And I felt that the counselling psychology doctorate would sort of give me good career progression and good career opportunities.
My background is in health psychology. So I did a master's in health psychology and I worked in the field of health psychology for a few years, doing research and working in academia. And I was doing a lot of work looking at the impact of interventions, but not actually being part of those interventions. So after a few years, I realized that I wanted to work more in the therapeutic process. And so I looked at my options, and counselling psychology appealed to me because it provided the consultation experience, looking at one-to-ones with clients, with couples, with groups, but also I could use my research experience, which is what I use predominantly in health psychology. My route into counselling psychology was not a linear one. I started off doing the stage 1 training in health psychology, which was a master's in health psychology. And from that, I also started a placement that was looking at working with victims of crime, a telephone helpline, and I worked there for 7 years. And I also worked as a volunteer looking at inmates and helping them work with the difficult emotions they had in prison.
I became a counselling psychologist by doing first of all, I did an undergraduate degree in psychology. I then worked in a basically completely unrelated fields really for a few years. I then decided to start working in mental health. So I worked as a support worker, I worked as a counsellor, included working in charities. I then did the counselling psychology doctorate, which is a mix of taught lectures. You do a doctoral thesis and you also do clinical placements in a variety of different services, getting a really great range of different skills and experience, and that gives you that real clinical experience of working directly and indirectly with service users.
I work as the lead of the psychology service, working with the different teams that work in the community health environment. I work with the physiotherapist, the occupational therapist, the district nurses, the healthcare assistants, and we all work together in a multidisciplinary team to look at the best options for the patient and to improve psychological thinking for the staff and for the patients so that they get the best care that we can provide.
I work directly with clients and service users, so thinking about kind of offering assessments, screening service users as being suitable for services, offer one-to-one therapy, also offer group therapy, and I supervise psychologists, trainee psychologists, and clinical associates in psychology in training.
I like working for ELFT because there's so much opportunity to grow. You have a really good support structure, and there are loads of psychological professionals that you can get help from, that you get support from, and you really feel as though you're part of the community. You're part of the wider network and you're part of the smaller network. And there's a lot of opportunity to be creative in the interventions that you provide for clients one-to-one, with groups or with couples, with peer support workers. There's a lot of multidisciplinary working. And that's one of the main draws to ELFT, because the vision in Newham especially is multidisciplinary team working. And you do get to do that. And with my background in health, it's really important to work with the wider team as well as the psychological team in bringing the best care to your clients and your patients.
I like working for ELFT because we really place a strong emphasis on quality improvement and also getting service users involved in developing and shaping services. So we have a strong people participation team, and we kind of work closely with them to make sure that service users' points of view are really being heard in the way that we do things.
I hope that you have enjoyed these videos and found them informative, and that they will encourage you to consider possibly joining us in the psychological professions. Whether you're in education now perhaps or considering a career change, it would be great if you would consider joining the psychological professions and working alongside us.